Yeah, so I think there are a couple of exciting things to think about when we consider HIV prevention, both around pre-exposure prophylaxis or PrEP. A regimen using tenofovir and emtricitabine, but only used around the time of sexual activity or on-demand PrEP, has been used pretty widely in Europe and beginning to be used more and more in the United States. This is called 2-1-1 PrEP, where you take 2 pills of tenofovir emtricitabine 2 to 24 hours before sex, a pill 24 hours after sex, and then a 4th pill 48 hours after sex. And so that's called on-demand or event-driven PrEP, or 2-1-1 PrEP. I think we're going to see more and more use of this in the United States, and we're really going to have to think about how we monitor folks on this regimen, how people are using it versus choosing to use daily PrEP, and how we can best kind of support those folks to use this regimen effectively for prevention. The other exciting thing that I think is on the horizon that we won't have an answer for the next couple of years, but is injectable cabotegravir that's currently in clinical trials in the HPTN 083 clinical trial here in the US and in clinical trials internationally as well. And in that study, we are comparing injectable cabotegravir that's delivered every 8 weeks in intramuscular injection versus oral tenofovir emtricitabine, also for PrEP. And that's delivered on a daily basis, oral tenofovir emtricitabine. If that is shown to be as effective as oral PrEP or oral tenofovir emtricitabine, that will also be a very exciting option for people that don't want to take a pill every single day. They can just have an injection every 8 weeks for prevention. So those are the 2 things that I think are most kind of exciting and likely to see change our practice in the near future.